We did our presentation on coronavirus 2019, also known as COVID-19. The people presenting today will be Blake Weidman, Carolina Reyes, Chris Gintu, Erica Malagon, and Fam Seychell. Coronavirus 19, also known as COVID-19, is a disease caused by the SARS-CoV-2 virus, which stands for Severe Acute Respiratory Syndrome Coronavirus. This virus was first discovered in December 2019 in Wuhan, China. This disease is believed to be spread by respiratory droplets when a person talks, sneezes, or coughs. This virus can affect the upper respiratory tract and produce flu-like symptoms. If the virus affects the lower respiratory tract, then a person may have a productive cough and have difficulty breathing. Severe cases of COVID-19 may lead to pneumonia or acute respiratory distress syndrome. This chart shows the statistics for the week of September 17th. In San Joaquin County, Stockton has had the most cases and deaths since the pandemic has begun. Stockton has also had the most new cases as well.
Signs and symptoms of COVID-19. This information was taken directly from the Centers for Disease Control and Prevention, or CDC, website titled Symptoms of COVID-19. What's interesting about COVID-19 is that the signs and symptoms that are presented with this illness often mimic things that someone may feel on a day-to-day basis, and they often are the same signs and symptoms that you may see in other illnesses. So they are kind of confusing and yet extensive. So for the basic signs and symptoms of COVID-19, they are fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. Again, it is very important that you understand how you feel when you're not sick, and that you take note when you start to feel these signs and symptoms so you can take appropriate action that we will explain later. Well, you may be wondering, when should I seek emergency care? When is the right time to go into the hospital? When do I need to go to the hospital? Well, this information was taken directly from the CDC's website titled Symptoms of COVID-19. And this is when you should seek medical attention immediately. Since the virus affects the lungs directly, if you're having trouble breathing, if you have shortness of breath like this person on the slide, seek medical care immediately. Also, if you have persistent pain or pressure in your chest, new confusion, the inability to wake or to stay awake, or if you have pale gray or blue colored skin, lips, or nail beds. If you have any of these symptoms or signs, please seek medical care immediately, as it is most likely an emergency.
Even though we are all still learning new information about COVID-19, research has shown that some people may be at a higher risk for being hospitalized with COVID-19. Certain risk factors play a key role in contracting COVID and being hospitalized. The CDC puts these individuals at a higher risk. First, we have our older age population. According to Centers for Disease 2021, more than 80% of COVID-19 deaths occur in people over the age of 65, and more than 90% of COVID-19 deaths occur in people older than 45. Diseases or illnesses that weaken your immune system put you at risk for being hospitalized due to the inability of your body to cope with another infection. These diseases can include cancer, cystic fibrosis, liver disease, COPD, or HIV. Then we have more common factors like obesity, diabetes mellitus, pregnancy, and even being a smoker. These diseases may not be preventable in order to reduce your risk for being hospitalized with COVID, so it's important to wash your hands and maintain your distance from people who are ill. Here we have some charts that can help us understand and see the numbers of the deaths that have occurred per the high-risk populations. It's broken down by race and ethnicity, the total deaths, and then a percentage of them. This chart here shows us the deaths by the age group. However, during this current surge of this year, those numbers have changed. It has become very common know how to get tested for COVID-19, but here are some examples of the diagnostic tests we perform. We have all seen signs for the rapid COVID tests or seen links on our social media directing us to sjready.org, which is the main site to find a local COVID testing center based on your needs. COVID-19 can be diagnosed in a couple forms. The most common diagnostic exam is called a PCR test. It includes the It includes the most common diagnosing method of obtaining the nose swab. This COVID-19 test detects genetic material of the virus using a lab technique called polymerase chain reaction, according to the Mayo Foundation of 2021. Another diagnostic exam that is currently being used by many providers and you can buy it over the counter is called an antigen test. This test is also a nose swab, but this one is able to look for certain COVID proteins in the sample. According to the Mayo Clinic, a positive antigen test result is considered accurate when instructions are carefully followed, but there's an increased chance of false negative results, meaning it's possible to be infected with the virus but still have a negative result.
While COVID-19 is a new disease process, we do know that it can cause pneumonia, respiratory distress, sepsis, it can make us susceptible to infections, and it can even cause death. In pneumonia, the lungs become filled with fluid and become inflamed, and this leads to the difficulty in breathing or shortness of breath. Now, this shortness of breath can be severe enough to get hospitalized with oxygen or a ventilator. The air sacs in the lungs become filled with fluid, which limits ability to hold on to the oxygen. Now, depending on the severity of the pneumonia, lung injury may result in breathing difficulties months after the disease has passed. The shortness of breath can lead to acute respiratory distress syndrome, which is a form of lung failure. Patients with acute respiratory distress syndrome may require ventilator support to help them breathe. People who survive acute respiratory distress syndrome and recover from COVID-19 can have lasting pulmonary scarring. When a person is experiencing severe COVID symptoms, the body is expending energy to regulate the symptoms and the body. And so the body and the immune system become weakened. Now, this is when bacteria or other viruses take the opportunity to invade the body. This is also what happens when exacerbations of other diseases occur, because the body is so busy fighting off COVID. Another complication of severe cases of COVID is sepsis, which is when tissue damage occurs systemically, entire organ systems start to shut down. And these create lasting damages to those organs. Now, death can occur from any of the previously stated diseases or infections. The body goes into multi-organ failure in which 2 or more organ systems completely dysfunction. And there's no answer to what causes organ failure, and depending on the patient, there can be many factors involved. After learning the complications of COVID-19, it's important to prevent getting the virus. So let's wash those hands for at least 20 seconds with soap and water, or use a 60% alcohol-based hand sanitizer until your hands are dry. Please wear a mask to protect yourself and others. Get vaccinated. Get the booster shot if you're eligible. Now, you might hear people are still getting COVID even after being vaccinated, which is true, but you're less likely to experience severe symptoms if you're vaccinated. Stay at least 6 feet apart from other people and avoid crowds and poorly ventilated spaces. Always cover your cough or your sneeze with a tissue and then throw that tissue in the trash. Clean frequently touched objects and surfaces on a daily basis. Now let's practice these preventative measures to prevent us from getting COVID.
Hi, this is Chris. I'm going to be talking about some common nursing interventions in managing patients with COVID-19. Patients can be presented with symptoms of varying degrees of severity, as well as having their own comorbidities. These interventions are the most common in the care of patients with COVID in the healthcare setting. Focused respiratory assessment would be auscultating lungs, noting lung sounds, noting accessory muscle use, respiratory effort, presence and quality of their cough, secretions if they have any, mucus and sputum, the amount and color. And this is just to see how they're doing right now and if the interventions were working prior to before being admitted, seeing if they're getting better or worse. You'd want to monitor vital signs, especially their O2 saturation, telemetry, temperature, respiratory rate, and the facility that you might be at, they all have different guidelines and for different severities of COVID-19 symptoms. Maintaining strict hand hygiene, use of PPE, which is gown, gloves, N95, face shield, or goggles. This is to protect the patient from other HAIs, protecting yourself and your coworkers, as well as protecting other patients from getting COVID-19 who are COVID negative. Patient proning, this can help expand dorsal lung regions as well as aiding in mobilizing secretions. Uh, for some patients, they might not be able to tolerate proning, but it's just going to be dependent on the condition and tolerate how well the patient tolerates. Supplemental oxygen is ordered if you want to go up from a nasal cannula to a simple mask to a non-rebreather, or all the way to a BiPAP, or if you want to go the opposite way if they're doing better and can tolerate less oxygen. Some pharmaceuticals that might be ordered for nurse administration include dexamethasone and remdesivir. Community resources to manage COVID-19. San Joaquin County has a diverse collection of resources available, which range from referring residents of the county to low-cost to free COVID testing sites, financial resources for families who are financially impacted by the pandemic, housing and property resources for those affected by the pandemic, essential services and local businesses with updated hours of operation, as well as more miscellaneous ones like funeral assistance for deaths attributed to COVID-19. And as always, if it's a emergent medical situation, always call 911.
Thanks for joining us today, everyone, to learn more about COVID-19. Please remember to do everything you can to keep yourself and especially our community safe here in San Joaquin County. Thank you so much.